Today's topic is spasmodic dysphonia. Spasmodic dysphonia is a neurological disorder that affects the muscle of the voice box or larynx and ultimately affects speech. The vocal cords or vocal folds are located inside your voice box or larynx. During speech, air from the lungs is pushed between the vocal cords. Sufficient air pressure causes the vocal cords to vibrate in just the right way to produce voice. With spasmodic dysphonia, an abnormal nerve signal is received by the muscle in the vocal cords, causing the vocal cords to experience sudden, uncontrollable movement. This disrupts the ability of the cords to vibrate and produce voice. This sudden, uncontrollable movement is referred to as spasm. These spasms cause the voice to break with a strained, tight, or strangled voice. Spasmodic dysphonia is a lifelong condition and can cause problems ranging from trouble saying a word or two to being unable to talk. It is prevalent in women, particularly between the ages of 30 and 50. Three main types of spasmodic dysphonia exist. They include adductor spasmodic dysphonia. This is the most common type of spasmodic dysphonia. It is characterized by an uncontrolled muscle spasm causing the vocal cords to close and stiffen. These spasms make it difficult for the cords to vibrate and make sounds. Words may be difficult to start or are often cut off due to the muscle spasm. Abductor spasmodic dysphonia. It is characterized by a sudden involuntary spasm that makes the vocal cords open too far, preventing the cords from vibrating. This allows extra air to leave the lungs during speech. This type of dysphonia may cause the voice to sound weak, quiet, and whispery. Mixed spasmodic dysphonia. This is the rarest form of the condition and is the combination of the other types of spasmodic dysphonia. In this type, the muscles that open and close the vocal cords are abnormally functioning. It is characterized by symptoms related to both adductor and abductor spasmodic dysphonia. Causes. The cause of spasmodic dysphonia is unknown. However, it is thought to be caused by abnormalities in an area of the brain called the basal ganglia. Factors that may predispose an individual to spasmodic dysphonia may include dystonia, a brain disorder that tightens the muscle, stressful events, upper respiratory tract infections, heavy voice use, a family history of neurological diseases, pregnancy, childhood measles, sinus and throat illnesses. Symptoms. Symptoms of adductor spasmodic dysphonia may include increased effort in speaking, strained, strangled voice. Voice cuts out while speaking. Symptoms of abductor spasmodic dysphonia may include breathy voice, weak, quiet, or whispery voice, soundless breaks in voice, increased effort while speaking, voice cuts out while speaking. Diagnosis. The condition may be difficult to diagnose because symptoms are often similar to other voice disorders. A team of professionals carry out diagnosis by conducting a careful examination. A speech-language pathologist assesses the quality and production of voice by listening to how your voice sounds. This assessment may include questions to gather information about voice use and symptoms. An otolaryngologist, or ENT doctor, examines the vocal cord structure and the activity of the muscles controlling them during speech. This is done to check for other possible causes of the voice disorder. A procedure called transnasal flexible fiber optic laryngoscopy may be used to achieve this. A neurologist evaluates the patient to look for signs of brain or neurological problems that may lead to such disorder. Treatment. No cure exists for spasmodic dysphonia. However, some treatments are available that can help to reduce symptoms. This treatment may include botulinum toxin or Botox may be injected into the vocal cords. The toxin prevents spasm by blocking nerve signals to the brain. Voice therapy may help produce a better voice. A psychological counseling may be able to help patients accept and live with their voice condition. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.